High Blood Pressure in Children and Teens by Maxwell, Kaiser, and Tiffany Knapp. High blood pressure. Hypertension or high blood pressure can affect anyone. This includes children and teens, not just adults. Hypertension occurs when your heart and arteries are constantly working harder than normal to move blood around your body, specifically when the heart pumps blood to the circulatory system and/or when the arteries resist that blood flow. If left untreated, it can cause serious long-term health effects such as heart disease, kidney failure, stroke, and vision loss. Normal blood pressure is around 120/80. Elevated blood pressure is 120 to 129/80, and hypertension is higher than 130/80. High blood pressure in children. For children under the age of 13, your pediatrician will use a percentile chart to compare your child's blood pressure to peers of the same age, height, and gender. A child is considered to have elevated blood pressure if their blood pressure falls above the 90th percentile, and hypertension if they fall above the 95th percentile. The American Academy of Pediatrics estimates 3.5% of children and teens have high blood pressure. If your child is diagnosed with hypertension, your pediatrician may recommend certain lifestyle changes to lower their blood pressure, such as a healthy diet, regular exercise, or weight loss. If severe, medication may be prescribed. Pressure in teens. Teens in the U.S. now weigh more and exercise less than in past generations. As a result, rates of high blood pressure among the group have grown at a rapidly increasing rate over the last 2 decades. It was once believed that high blood pressure in teens was largely related to an underlying problem with the heart or kidneys, but research shows this isn't the case and that teens today are developing hypertension in approximately the same proportions as adults. Teenagers with hypertension tend to suffer more cardiovascular events late in life. Early intervention is key to lowering their blood pressure and sustaining lifelong control. Here we have some informational images regarding high blood pressure. On the left-hand side, we have facts of high blood pressure in children. Just goes over normal blood pressure, how it affects and impacts kids, what high blood pressure can impact on your child's health, which is kidney failure, heart attack, or stroke, what the numbers mean, systolic, diastolic, and what can cause high blood pressure in your child. On the top right, we have high blood pressure facts. This shows an image of a sphygmometer, also shows an image on normal blood pressure, shows that 1 in 3 Americans are affected, and that it is the second major risk factor for heart disease after smoking. It also goes on to say that the number of years that lowering your blood pressure extends your life is 5 years. And on the bottom right, we have the high blood pressure diagram. It shows what the overworking enlargement of the heart can do and how it can fail, and if left untreated lead to congenital heart failure. And heart disease contributes to 75% of all heart attacks and strokes. Causes of high blood pressure in children and teens: obesity or being overweight, a high sodium diet, too much salt, kidney disease, congenital or acquired heart disease, thyroid or adrenal disease, diabetes, genetic disorders inherited from a parent or grandparent, or stress. Tests for high blood pressure. Once the blood pressure is checked with a sphygmometer, a blood pressure monitor, and hypertension is confirmed, the next actions are determining what is the root cause, primary or secondary. Blood tests to check if your child's kidneys functions, electrolytes, and cholesterol and triglycerides levels are normal. Urine sample tests, which is urinalysis, echocardiogram to create pictures of the heart and blood flow throughout the heart, and ultrasound of the child's kidneys, renal ultrasound. Health responses to high blood pressure. First is the DASH diet. Designed from research sponsored by the National Institutes of Health, the DASH diet focuses on eating fruits, vegetables, low-fat dairy, nuts, beans, and seeds. The second is exercise. The AAP recommends children and adolescents get 60 minutes or more physical activity daily. This includes outside play, and team sports. And lastly is low sodium diet. Sodium is a scientific name for salt in food. In addition to watching table salt usage, be cautious how much processed foods your child eats. Lastly is medical intervention for high blood pressure. In severe cases of hypertension, the child's physician may prescribe medications to control blood pressure. Listed below are some of the common medications for hypertension in children and teens according to the Mayo Clinic. Angiotensin-converting enzyme, ACE inhibitors. These medications help relax your child's blood vessels by blocking the formation of natural chemicals that narrow blood vessels. This makes it easier for the child's blood to flow, reducing blood pressure. Second is angiotensin II receptor blockers. These medications help relax blood vessels by blocking a natural chemical that narrows the child's blood vessels. The third is calcium channel blockers. These medications help relax the muscles of the child's blood vessels and may slow his or her heart rate. And lastly is diuretics, also known as water pills. These act on your child's kidneys to help your child remove sodium and water, reducing blood pressure.